Thanks for listening to the podcast today, and in this episode, we'll discuss what kind of services do home healthcare agencies provide if you have Medicare. After the hospital stay, a patient may be doing well enough to return home. However, the patient may not be completely ready to take on life as it was before the illness or injury. Home healthcare comes into play when a patient discharges home, but who still requires help and further recovery time in order to function as safely and independently as possible. In this episode, we have broken down what types of services home healthcare agencies typically provide, along with brief descriptions of each service. Not every patient will require all services because every individual's road to recovery varies in length and in potential obstacles. If and when the time does come to participate in home health care, it's helpful for first-time clients to familiarize themselves with all the home care services available to them. Let's look at what services do home health care agencies provide to seniors living at home. First, nursing care. Registered nursing (RN) staff come into the home to provide professional duties, similarly to that in a hospital or an outpatient setting. Medication administration and management, IV placements, catheter placements, vitals monitoring, and all other medical procedures, interventions, and tests approved and supervised by the primary physician. CNA, home health aides. Certified nursing assistants, or CNAs, work under the supervision of registered nurses and can provide non-medical routine tasks that assist the client at home. Such tasks include ADLs, activities of daily living, like showering, dressing, toileting, feeding, and hygiene tasks. CNAs are also trained to perform transfers, such as helping clients get from the bed to the wheelchair safely. Some CNAs and home health aides may also assist with basic house cleaning tasks. Next, rehabilitation. This includes occupational, physical, and speech therapy services. Each therapy discipline will come into the home as ordered by the primary physician and perform evaluations to see if the client could benefit from therapy intervention. Each therapy discipline specializes in multiple areas. Occupational therapy for improving participation in activities of daily living, ADLs, physical therapy for leg strengthening and walking, and speech therapy for speech production. These are all very oversimplified explanations of each therapy, as they all provide so much more. Next, let's look at in-home doctor's visits. As part of the home health plan of care, primary physicians may make in-home visits on occasion. Since it's the primary physician who oversees and refers the majority of services, it is essential that he or she visits the client to review and adjust the plan of care over time and whenever necessary to gain progress in recovery. Next, let's look at respiratory care. Some clients who get admitted to the hospital have breathing concerns and medical conditions such as respiratory failure, pneumonia, chronic obstructive pulmonary disease, or COPD, or other diseases of the lungs. When they get discharged home, they may need additional respiratory care services at home. This includes supplemental oxygen, CPAPs, BiPAPs, tracheotomy care, and ventilator care. Operating breathing equipment and conducting regular breathing treatments are performed by respiratory therapists who could come into the home to provide intervention. Next, social services. Social workers or case managers may also be referred to come to the home. Their job is to make sure that the client and caregiver feel safe and can provide for their needs in the home on a long-term basis. While the doctor is the main individual to refer services, the social worker acts as a coordinator of services to make sure the client is receiving full quality care. They can also provide resources to clients and caregivers for additional community and medical support. Now let's look at pharmaceutical services. For some clients receiving home health care, going out and running errands to the pharmacy is just not an option. This is especially true for clients who don't have caregivers or family members living close who could run the errand for them. That's when home health pharmaceutical services come into play. Medication can be dropped off at the home on a regular basis. Next, transportation. For clients who are immobile or cognitively unfit to safely drive or have no family to provide assistance, transportation can be provided. Transportation services commonly help with clients to necessary medical appointments. Next, labs and x-ray services. Blood test and x-ray services can be brought to the home. This is especially important for patients who need consistent and close monitoring as they progress through their recovery. However, primary physicians may also order these tests of symptoms that are out of the ordinary or not obviously related to current diagnosis. Now let's look at voluntary care. Home health care agencies may coordinate with students or other non-paid persons who are interested in volunteering their time to assist clients in the home. Their responsibilities are extremely limited due to the lack of education and certifications. In fact, many agencies don't allow volunteers to even physically touch clients. Thus, volunteers are primarily there to help with rote tasks like cleaning and others, and to provide clients with appropriate companionship and emotional support. The next area is nutritional and at-home health care. Dietitians may set up a consult with clients in order to ensure that their daily diet is well managed and overall healthy. This is beneficial for persons whose diets may be out of control and contributing to the current health problems. For example, uncontrolled diabetes, poor cardiac diet, etc. Home health agencies can also arrange for companies such as Meal on Wheels to drop prepared food at the door. Each service listed has a certain schedule depending on what is ordered and what health insurance will cover. Home health care employees will make visits to the home either several times per week or several times per month for a specific medically ordered duration. Although many home health care agencies in the United States offer all of these services, clients and caregivers who are looking into home health care should research and check with each and every agency. Primary physicians will make recommendations and referrals about what services would be most pertinent to the client's plan of care. Still, a client's experience and recovery time will be the most beneficial to them if they have a say in their own plan of care. Learning about each service ahead of time helps clients and caregivers to make well-informed decisions about their own health care at home. Thanks for listening to the podcast today, and if you'd like more great information about senior care, subscribe to this podcast and visit seniorhealthcarehq.com. Once again, that's senior, SENIOR, homecare, HQ.com.